Hey everybody, it's Chris here from WMS Hormone Optimization. I wanted to go over reconstituting and how to draw it from vials. So you've had your evaluation done, you had your blood work done, and you're about to get started on testosterone therapy or peptide therapy or HCG, what have you. You get a big box in the mail and you start pulling stuff out and you're like, all right, what do I do? And so don't feel bad. Everybody has to go through this the first time, so what I want to do is walk you through what we're going to do. So you start to unpack your bag, and this is going to be a little abbreviated because I didn't want to fill up this box with everything that you might actually get. So I'm going to start arranging some stuff over here. So you might have some bacteriostatic water or sodium chloride. They're interchangeable. My preference is bacteriostatic water. Sodium chloride can have a little bit of a bite with it, so if you get it, sorry. It's normally because if anything's going to be on back order, it's going to be the actual bacteriostatic water. We have some insulin syringes, some 10 cc syringes. This is a multi-access port. We'll talk about this later. Chances are you're not going to be able to get this from the pharmacy directly. I do order these in bulk from McKesson, so if you're in the office and we want one, let me know. I'm happy to get them to you. All right, a couple more draw needles. This will be one of our medications. This will be another of our medications that we're going to look at. A couple of insulin syringes here for demonstration, and just another 3 cc syringe. So, okay. So when you organize things, one of the most important things you can do is look at your needle size. All right, so when we're talking about needle size, we use gauges. So much like people with earrings and piercings, the smaller the gauge, the larger the needle is. So the pink one, generally, is generally accepted. Pink is going to be an 18 gauge needle. All right, this is a harpoon. You don't want to stab yourself with this. The next one you might see from me would be a 23 gauge. So this is going to be light blue. All right. Every once in a while, you may run into somebody who prescribes you a 21 gauge needle. That one will tend to be gray, but that's not something that I like to use because most any oil can be pushed through a 23 gauge. The one that I really like whenever possible is a 25 gauge. This is the one that leaves the least amount of scar tissue. It doesn't hurt very much, and as long as you're not trying to push a massive amount of oil through a 3 cc syringe, this one will work pretty well for you too. So this is kind of my go-to. If you don't like it and you're like, I do better with the 23 gauges, I use the 23 gauges too, but it's mostly because I'm impatient and I don't want to wait for the oil to go through the 25 gauge. All right. So we'll say you get your order, you open up your vial or your prescription thing here, and then this is what it looks like. You got yourself a 10 ml vial of something. All right. You got to get into it, and so the best way to do it would be the multi-access port, which I'll show you at the very end how that goes in. But for the vast majority of us, we're going to end up getting an 18 gauge, and then we're going to need to draw it up and then move it to a different needle. So you have alcohol pads will come with you also, and so I generally send out 100 at a time, so you always have an excess of alcohol pads. They're not expensive. If you need more alcohol pads, another thing, just ask for them. This is a dust cap. This does not keep the area under it sterile. So when you do it, you peel this thing off, and you can actually see your rubber port that you're going to stick into. So, good rule of thumb, use your alcohol pad, clean the top before you go into it, and then at least in school they taught us you basically just leave your alcohol pad on there too. So in this case, I'm going to use a 3 cc syringe, push the air out. 18 gauge needle is going to be your draw needle. Like I said, this is the one you don't want to stab yourself with. This is the one you want to use to pull up the oil. And this is if we're talking about testosterone, nandrolone, or any other oil-based substance. All right, so I'm there. I'll take this off, one last little wipe. I'll do something like that. I'll actually pull back to the dose that I want. So in this case, I'm going to use 100 milligrams. So what I'm going to do is I'm going to go ahead and put this at the 0.5. Now this is important to realize that for 0.5 of this is dosed at 200 milligrams a milliliter, and since I'm trying to pull up 100 milligrams, I want half of a milliliter because I'm looking for 100 milligrams for my dose. This is something that we would talk about in person to determine your dose, and then I will tell you where to pull it up. If you have questions, don't guess. Please call me, text me something, and then I'll tell you what to do. All right, you want to go dead center of this, all right? You'll push in the air. In this case, it's not a lot. and then you pull back. And I always pull back a little bit past, come back up to the 0.5 to verify that I have my dose where I want it. All right, so that black plunger line is right there. Pull straight out, okay? Now, it's very easy to stab yourself with this if you do it like that. So since we're not ever gonna use this needle again, it's okay. So one of the easy ways to do this for your sake is to actually go ahead, stick the cap on the ground or on the table like this, and then just insert the needle, lift up like that. All right, easy as that. So now you're good to go here. This is still sterile and contained. And then you're gonna pick the needle that you want. For me, this is because I'm going to put this in myself right now. I'm gonna go ahead and choose the 23 gauge because that's the one I want. So I'll open my package, just like that. We want this area to be sterile. This is a lure lock syringe, so it's got something that you twist on and you can twist off, all right? You twist off this one, you're done with it. It's gonna go into a sharps container, and now you're ready to go. So this thing is ready to be injected at this point, okay? Leave that right there. And so that's for an oil purpose, all right? Now, if we're going to reconstitute HCG or we're gonna reconstitute peptides, per the pharmacy, what I'll do is I'll have directions on how much fluid I want you to reconstitute something with, okay? So depending on the type of peptide that we do, it's gonna be a little different. I'll give you instructions on it and it'll be in the prescription itself. Now, it's pretty standard when we're using HCG because these things come in 5,000 unit vials, okay? So there's gonna be a little powder. Now this is a reconstituted one, but I didn't wanna open up a brand new one, so I'm gonna kind of walk through what I would do in this situation, all right? So this is a bunch of powder that'll be sitting in the bottom of this, all right? Dust cap will be on top, same process. What you're gonna do is you're gonna flip off the dust cap. Don't assume it's sterile underneath because it's not, it's just a dust cap. Use your alcohol pad, wipe off the top. If you wanna leave that alcohol pad on there because you're anal retentive, you can do whatever you want, but really if you just use alcohol pad to wipe off the top of it, you're doing better than 99% of the people out there, all right? You're gonna get a 10 cc syringe this time, all right? Same thing, I like to open up my packages just to have them ready to go for me. 18 gauge needle, harpoon, like we talked about. Open that up. I'll take this. Actually, this one thing first. This is bacteriostatic water, or sodium chloride in this case. Same thing, dust cap comes off just like that. Wipe off my top. I'm gonna do this. I'm gonna go ahead and hook up my needle to my syringe, lure lock like we talked about. It'll twist right on. And for simple math purposes, I like you guys to reconstitute 5,000 IU of HCG with 5 mLs or cc. An ml is the same thing as a cc, just in case that does confuse anybody out there. So I draw back 5. I'm gonna go into this, pull my cap off like we talked about. Dead center, try not to stab yourself. Push my air in there and you'll see it kind of backfills a lot of this for me, all right? You go right up to the 5, right where I'm at. A smidge of an air bubble will not hurt you, contrary to what you see on TV. Now we're ready to go, all right? So what I'll do here, and this one isn't gonna take it, this is not gonna take the whole thing, okay? So at this point, what you do is you actually will inject this straight into the HCG vial. So it'll go in just like so. Now depending if there's a vacuum in there or not, it might just pull the fluid for you, and that's fine. If you need to push the fluid in a little bit, push in, let it backfill with the air, and it'll decompress, decompress, decompress. Now since this is full, it's not gonna take any more, so I'm not gonna do it all the way. So just to make the assumption that we did this, and now this is in there, you never wanna shake this violently. You just gently swirl. Now this applies to peptides also. You're just gonna swirl it, swirl it, swirl it, and then let it sit there. And you want to make sure that it sits there for about 15 minutes so that way the molecules can really kind of diffuse into the fluid as good as possible before you give yourself an injection, all right? Peptides or HCG, once you reconstitute something, it needs to be stored in the refrigerator after that. So that's your important point there. Now, when we're talking about HCG, I tend to dose in the 250 unit or 500 unit guidelines there, and it may be multiple times per week per dose. It kind of depends on what we're looking for. So the reason I like to put in the 5 mLs of fluid with the 5,000 IU is that it makes measuring on the insulin syringe incredibly easy, all right? So you're gonna get a bunch of insulin syringes. I don't know the brand they're going to send you. That can change from day to day, but there's going to be a few things consistent. I always order 1 ml. So the entire length of this inside of the syringe is going to be a full milliliter. Okay, let's make sure I didn't grab one that said 0.5 on it while I'm showing you guys this. You pull off the cap. It's like this. It's a very sharp 31 gauge needle. Now the way I do it is the same way. I'm going to say, so we'll say that we're doing 250 units of HCG. All right, I'm going to pull it back to the 25. All right, if I wanted 200 units of HCG, I'd pull back to the 20. If I wanted 500, I'd pull back to the 50. Just divide by 10. Dead center of this. All right, I inject my air in, and then I pull back a little bit further than where I want to dose it at. This situation, for this example, I'm going to go ahead and pull this to the 25. All right, we come up there. And now you have 25 on your syringe. You have 250 IU in the syringe ready to be injected for the purpose of HCG. Now, peptides, I said, we'll discuss that individually on a case-by-case basis. But the foundation of how you reconstitute something remains the same. All right. If you have any questions, please feel free to text us. You can call, text, leave comments. I'm happy to answer anything that is a reasonable question. Okay, now let's talk about using the multi-dose access port. This is something I very much like, and I think you guys will too, because after you just watched me go through, changing the needle, putting the 18 gauge in, going back and forth on it, I want to show you how easy this is. So we have a vial, dust cap like we talked about before. I'll set that right there. Alcohol pad. So when you demonstrate something, you might as well demonstrate it the right way. All right, good there. Now instead of hooking this up to the 18 gauge, what you'll do is you'll open this up. Now you do want to keep it sterile. That's still very important. So this back part, you're going to look at it like so. All right. So what you're going to stick into the top of the rubber port there is this little sharp end there. So you'll take it. It's already been wiped off. I'm going to stick it just in the dead center, and then as I get in there, I just kind of spin it. And it's got a couple hooks in there to really will prevent you from pulling that off. Now you can pull it off and it'll break these wings off inside of there, so you really don't want to do that. But now you have this on there. So I still want you to treat this like a regular port, okay? So before you access this, use your alcohol pad and just wipe off the top there, just because any sort of funk, dust, or just the nasty stuff that exists in nature gets on there, and you don't want to inject that into yourself. The difference being is that now, when you take your syringe, push your air out, hook up. Now, if you look at it, you're hooked right directly into there without a draw needle, all right? So say we want to do 200 milligrams this time. So I pull out like so, push all the way in here, bring it up to the 1, because that's our dose now. And now when I twist this off, you're ready to go. All you do is you hook this into whatever needle you want to use, and then you're ready to rock. You don't have to actually switch out the needles, and less of a chance of actually hurting yourself with it. Over time, if you don't inject air into this thing, you're going to create a pretty strong vacuum in here, and it's going to make it harder to pull that out. So what I didn't do on this time is show you what I should have done, which was pick my dose, 1 ml, just like we're talking about before, put it in there, plunge up, and then pull back out. Now, just, a little trick for later. All right, so we're good there. A little trick for later. So say you routinely pull it out and pull it out and pull it out, and you end up with a big vacuum in there, and you try to pull back on your vial, and it keeps tugging on it. It's a real easy fix. So just disconnect it, pull back 3 cc's worth of air, hook it up, push the air in, disconnect it, pull back, push the air in until it no longer has a vacuum effect, and you'll kind of mitigate that entire, back vacuum thing that it makes it hard to get your dose. So like I said, any questions about this, reach out to me. I did speak to some of the pharmacies about, maybe perhaps getting them to carry these, because it'd be nice to be able to send you 1 of these as opposed to 10 of the 18 gauges. If they're able to do it, I'll pass that on. But in the meantime, if you want 1 of these, just ask me and I'll take care of you. All right, that's it for now.